We should be seen right away, because the only thing is that it's gonna happen is her pain is gonna continue to get worse. And it makes you feel like that you're helpless. And as a parent, it makes me feel like angry. And it makes me want to fight back and scream and cry. It just makes me feel like they don't really care about you.
The project I'm working on is the Emergency Department Sickle Cell Education Project. And my job is to go into the emergency room and to properly educate the staff so when sickle cell comes into the emergency room, they know exactly what to do and how to handle those persons.
What I need most is, number one, to be seen by the doctor in a timely manner. I need to get back there, get IV started, get pain medicine started, and be treated like a human being. That's what I need most when I go into the hospital.
I'm a father, and to be honest with you, it's not really about what I need most, it's about what my kids need most. I'm going in there and I'm taking them because we have some sort of a scenario that's playing through, and most likely it's a sickle cell scenario, and it may involve pain. So at that particular point, from the emergency room attendants and all those involved, I need a little bit more compassion and a little bit more understanding.
Nationwide, emergency rooms do not understand how to properly deal with sickle cell when sickle cell patients come into their facilities. And we're trying to educate as many staff members as possible so that they can be treated properly when they enter into the emergency room.
My name is Demetria Kelly, and I have a daughter named Michaela Drawn. She's 8 years old and she has sickle cell.
My name is Salim Adams. I am 42 years old. My hemoglobin type is SS.
My name is Anderson Cavalier III. I have two daughters that have sickle cell disease, ages 13 and 16.
When she went to the emergency room, we already prepared, we called ahead, letting them know that we were gonna be on our way. And when we got there, it took them almost like an hour and a half to even see her. And when we got back to the room, the nurses didn't know what to do. If they should start an IV, if they should, they were waiting to ask the doctor, and the doctor took forever to come into the room. And finally, when the nurse, we buzzed the nurse to come in and said we hadn't been seen, Michaela was screaming in pain. We couldn't get her on any medication. She was crying, she was moving, she was jittery. It was just the worst, most uncomfortable feeling you can ever see your child in. It was so painful for me, it was painful for her father, and it just was something that it was unbearable.
I was in a very bad pain crisis. I guess it was off the scale. It was way more than 10. And so the doctor was, taking his time, the nurses are taking their time, sitting out in the waiting room for at least about a good 30 to 45 minutes, and it's just getting worse and worse. So by the time I get back there to the bed, now I'm crying, I'm balled up in pain, and it's like somebody just beat me with a spike bat repeatedly with no relief.
My worst emergency room experience is one that really bothers me to today. We were in a car accident. As I said, my daughters both have sickle cell anemia. My youngest daughter, Taryn, after the car accident, she began to have a pain crisis in her arm, where you bend the arm by the elbow. It was a knot that actually formed there. And we took her to the emergency room for the second time after we had the initial accident, and we were told that we were abusing our child. Now, the first thing that came into my mind is here that my daughter is in pain, and now you're accusing me as her father and her mother for actually abusing her instead of listening to us when we were trying to explain to you that she has sickle cell anemia.
We do in-service presentations to medical providers, especially in the emergency room, and even their social workers need to understand the psychosocial side of what sickle cell patients deal with.
All of my best emergency room visits started and ended with them being aware that we were coming. From the moment we hit the emergency room, we never had to wait inside of the waiting room. We went automatically to the back. The sickle cell doctor was actually the doctor making the calls instead of the doctor on call who may have not known anything about sickle cell.
So the nurse walks in and she looks at me and she says, "I'm not gonna give you this medicine because I don't think you're really in pain. I think you're just looking for the drugs." And at that time, I was only like, what, 18, 17, something like that. And that really, really hurt even more, because now I'm being labeled as a drug addict when that's really far from the truth.
We were there for about 7 or 8 hours after she got the IVs and was, kind of stable. And they sent us home. And they sent us home. Michaela was screaming hysterically. She was passing gallstones, and they still sent her home. They didn't even know that she was even going through that pain. They must have overlooked it or didn't realize that she was going through that. And she went home and she laid in the bed and was like having like these spasms, and she would like not be able to sit. She literally cried for like 22 hours straight. And they said it's just, she'll be fine. If you go home, she'll be fine. Just give her pain medication, give her ibuprofen. And that wasn't even strong enough for her. Like, she was still crying, and she would like literally have to sleep her pain away. And every like 10 minutes she would wake up and scream really loud. And we had to go back to the emergency room that same night.
For a sickle cell patient, anything can happen. I could have a heart attack while I'm waiting for somebody to get over pride issues or whatever the case may be. It's unpredictable, and we're already given a short lifespan by the medical community. And I just want everybody to understand that it's nothing to play with.
If they were understanding that their child or anybody that they know was going through any type of pain to the point of you can't help them in any way, you can't fix it, you can't change it, they should understand that it's something that we can't control, and we can't bear it, and we can't help it, we can't change it, and we can't fix it. But I do think it's something that we should be able to try to help in every way possible. So just putting themselves in the situation of the parent or the sister or the brother or the mother or whoever, that if they were close to anybody and they seen somebody going through that much pain, they would want to help them.
We really hope that this project improves the lives of sickle cell patients when they come into the ER. Whether it's a physician who better understands how to care for sickle cell, or it's a social worker who might be dealing with the sickle cell patient after they have visited the emergency room. And the more people that know about how to better deal with sickle cell, the better off the sickle cell community is, and that's our hope at the end of the day.